Hello and welcome to week 4. Hard to believe that you're almost halfway done with this course already. This week we're going to shift and look at 3 other nurse theorists. The first one we're going to look at is going to be Martha Rogers, and she's going to be applied to your discussion board. So let's take a look at your discussion board assignment here. Consider what was happening in nursing in the late 1970s and early 1980s with the change from diploma programs, which were 3-year programs, to an associate degree program, which are 2-year programs. Martha Rogers believed that nursing is a separate and essential discipline and a unique field of study. She worked hard to establish nursing in higher education. So what we want you to do is explain the importance of this shift in nursing care. What happened to the job market? What happened to the skills? This affected lots of different things, and we're still seeing some of that impact today. But now we're seeing fewer and fewer diploma programs and more associate programs. So as always, make sure your primary post is 400 words minimum with a reference, and please cite it correctly. And then your 2 response posts, minimum of 200 words each. Now, let's move on to your assignment. This week we're going to shift back to a paper. The paper needs to be anywhere between 1,000 words and 1,250 words, so make sure you're keeping an eye on that when you're doing this assignment. So for this week, we're going to look at King's conceptual systems theory. One of the things that you're going to do with this theory is really just kind of discuss it and explain it. But then we want you to apply it to a patient that you have had in your setting. The second part of this assignment is actually going to be a case study on a mental health patient. And what we want to do is have you apply Levin's theory to her. How does this apply? What could we change? And then also apply another theory that would work for this mental health patient in this case study. With this assignment, make sure that you do use your textbook as a source and have 3 outside references. Make sure they're credible, and APA really does dictate that outside sources should be within 5 years or newer. Anything outside of that time frame they really consider is not current anymore unless this content has not changed, and you do come across that sometimes with nursing where the content just hasn't changed. So then it's okay to go ahead and use that source. But make sure you have at least 4 sources, 3 of them from an outside source, and then 1 is your textbook. If you have any questions, please feel free to email me. Thank you.